This is Jerry Hesch, and I'm teaching a whole body workshop in New York, and this is March 31st, 2019, and this is Melissa, who attended my workshop, and I treated her twice, and I'm going to have her tell her story.
Okay, hi. Yes, I was in a motor vehicle accident in 1994.
If you can speak up, because the pickup
sure.
is not good.
Yeah, so I was head-on collided in, it was 1994, it was probably about 55 miles per hour. And after that, I was in severe pain in multiple areas. Over this course of time, I have, gradually noticed more and more things becoming less functional, extremely painful, and chronic. So I've sought care and have gotten some wonderful relief and more function back over time. Unfortunately, most of the problem areas would the pain would reoccur and the dysfunction would reoccur within a few days, maybe not 100%, but even like 70%. So that I was grateful for the relief, but still not feeling like I had all the answers. So a friend told me about Dr. Hesch, and I knew he was going to be in New York, so I came, and he found my first rib to not move properly, and treated that with a force on the acromion, which separated the area. And that was last night, and he also found that my occiput, the part of my skull on the right, wasn't moving properly on the vertebra, the first vertebra below it, and released that with these very gentle techniques, and that my headache went away, and I was able to think more clearly. So I've been struggling with some brain fog for years, and then today I noticed, there's the chronic area here in my upper, in my rib area and my lower neck. It just felt like the lack of function in my left hand again. And he checked and found that also my clavicle was involved. So he treated that, and I'm feeling a lot more normal, better range of motion, feeling a lot more functional in my upper back, and I don't have any pain there. Obviously there's tension there because it's a chronic thing, but the actual pain is gone, and I'm very grateful. So I have a lot of hope, and I am now in a place where the physical therapy and the exercise I'm doing, I think, will start to really make a larger difference, and I'll be able to have better function.
And today and the rest of the class, we have the rest of the afternoon, I will teach you home program for keeping the mobility in your Occipitoatlantal joint and in the first rib and in the AC joints. And these were Hesch techniques that I used to treat you. And the upper cervical was, the occiput on C1 was stuck in an oblique manner, and that's not described in the body of literature.
No.
And the method of releasing the first rib was to treat it in the transverse plane, in contrast with the traditional technique that pushes the rib inferiorly.
Right.
And the AC technique is also unique to how I approach the body.
Right. It opens up the area to allow more healing and restored function. So, thank you.
Good, yeah. I'm very optimistic for you.
Thanks.
Thanks a lot.